5,942 cases of coronavirus. In Victoria, that's 275 new cases since our last update. 28 of those cases are connected to known and contained outbreaks. 247 of those cases are under investigation by our rapidly expanding public health team. There are 147 Victorians in hospital. 31 of those are receiving intensive care. I am sad to have to inform you that another Victorian, a further fatality has occurred. A woman has died in her 80s. That brings to 39 the total number of deaths as a result of this virus. There are some 2,913 active cases. In terms of testing, yesterday was 26,588 tests. And again, we take the opportunity to thank every single Victorian who's come forward to get tested despite even the mildest of symptoms. That's a really powerful contribution that every single person who gets tested makes to us being able to track this virus, to have people isolate in their home, to limit the spread. Logic tells you that without that sort of data, without that evidence, it becomes very, very challenging to limit the spread of this virus, no matter what settings you have in place, no matter what rules you have in place. So we're always very grateful to such a large number of Victorians coming forward and getting tested. That is now 1,331,774 tests since January 1. One of the highest testing rates anywhere in the world, and a central component, a key component to our battle against this enemy. James is going to speak a little bit about schools. Obviously today is the first day for remote and flexible learning for those prep to Year 10 students, other than of course students who can't learn from home because their parents are working, other than of course VCE students, including Year 10 students who are doing a VCE or VCAL subject, other than those specialist schools where it was deemed after a lot of work, a lot of very careful work with parents, as well as other kids with special needs. They will be at school, but everybody else will be at home. I appreciate and understand that that is very challenging for many families. That's not what we had hoped for term 3, but given the prevalence of the virus in our community, given the nature of our strategy about limiting contact, about limiting movement, it was deemed appropriate, based on the very best of health advice, to not have the best part of 700,000 students moving around Victoria each and every day, as well as of course their parents, guardians, carers. That is not conducive with limiting the spread of this virus, but I do appreciate and understand just how challenging that is at a household by household level, at a family by family level. I know our eldest is in Year 12, he's at school. Our other 2 kids are at home. They would much prefer to be at school with their friends. They'd much prefer to be learning that way. But we've all got to make the best of these very challenging circumstances. We can't afford to ignore the absolute truth of what we face, and that is that this virus is not yet contained. We need to drive these numbers down. The powerful reality of our circumstances, we can't wish it away. We can't ignore it. We've got to put in place a strategy that will be effective, provided that everybody across the state is a part of that strategy. I'm deeply grateful to each and every Victorian who is staying at home, only going out for those 4 permitted reasons, and limiting the number of times they go out under any of those 4 reasons. I'm very grateful to parents, very grateful to every single Victorian who is following those rules and making their own unique and powerful, a really powerful effort that will ultimately continue to drive these numbers down and get us to a place where we can begin opening up again, getting past this second wave. Just before I ask James to take us through some of the arrangements for masks in schools, some of the other arrangements that many of which I suppose they were first put in place, but they continue on for remote and flexible learning. I just wanted to make a couple of comments in relation to the hotel quarantine judicial inquiry that begins today. I want to thank both Justice Coate and all of those working to run that inquiry, to give us the answers that we need to understand exactly what has gone wrong in that hotel quarantine program. They've wasted no time. They've put in a power of work to get to this point, and of course that formally begins in a public-facing way. That formally begins today, and I'm very confident that that process will give us the answers that we are each entitled to. What has gone on here is completely unacceptable to me, and indeed unacceptable to all of us. But the best thing to do is to have that proper understanding of exactly what has gone on, those answers. That's what we're entitled to, and that's what the judicial process at arm's length from government will appropriately deliver. I'm very confident of that. I now might ask James just to speak about school arrangements, and then we're of course happy to take any questions you have.
Remote and flexible learning for most students in Melbourne Metro and Mitchell Shire. So we will have around 700,000 students today, Peter 10, learning from home. I know this is hard. This is a challenging time. Remote learning is not easy for parents and carers, for teachers and staff, and most importantly for our students. But my message to parents is be patient. Don't be hard on yourself. Your teachers know what they're doing. They did a brilliant job last time. They will do a brilliant job again. So we will get through this period. And in doing so, we're supporting students as much as we can. I've reported a number of times in terms of the support for students who don't have access to laptops and devices or the internet. I can advise you all we're now up to 61,000 laptops and devices for students who need them, as well as around 23,000 SIM cards and dongles. And this term also does look a bit different. We've already introduced, so we have for all students as they arrive for school, whether that's for face-to-face learning for our VCE and VCAL students in our special schools, or whether it's for students who need to undertake remote learning on site if their parents can't provide a home learning environment, if they're a student with a disability, or if they're vulnerable students. So we've distributed more than 14,000 infrared thermometers to schools right across Melbourne Metro and Mitchell Shire. And of course, from Thursday, our community will look different with the mandatory use of masks. And again, in this space, education is very well prepared. We already have 1.2 million single-use masks, and we'll be distributing those to all government schools in Melbourne Metro and Mitchell Shire over the coming couple of days. And we'll be also providing these single-use masks for our Catholic and independent schools. So work is underway with the Catholic system, with ISV, in terms of the logistics of rolling those single-use masks out. Secondly, there is an order for reusable masks. 1.37 million reusable masks have been ordered, and the Department of Education will be one of the first to receive the first batch of these reusable masks, and we'll have those by early next week. And again, we'll be distributing those out to government and non-government schools in Melbourne Metro and Mitchell Shire. And then, of course, many families already have masks. Many people are making their own masks, and students may also choose to wear bandanas or scarves to school. So schools will be a very interesting place from Thursday in terms of what the students are wearing, but these are masks and face coverings, so many students will choose to wear scarves and bandanas. But the bottom line is any student who needs a mask will be provided with one. For teachers, because I know there's many questions from teachers and staff, again, it's a very simple message. It is not a requirement for teachers in the classroom because it's not always practical. Teachers will be able not to wear a mask, or they won't be required to wear a mask during instruction, but beyond the classroom, in the staff room, in the schoolyard, teachers and staff will be required to wear a mask. And again, the distribution of the masks, both single-use masks this week and reusable masks next week, will be for staff and students at all our schools, all our government schools, and we'll be distributing and providing masks as needed to Catholic and independent schools as well. So I know this is a difficult time for everyone, particularly for our students and for parents in a home learning environment, but I want to reassure you that the government is providing all the support we can to make sure that we get through this difficult period safely and well, and our students are learning at home or on site at school.
happy to take any questions you have.
Given the number of cases down in the Geelong region, do you think you're going to need to extend the red zone, if you like, west a little bit?
Well, I think it's important to acknowledge that Geelong is obviously a much bigger community than many other regional cities. So the number of cases as a raw measure is probably not the best guide. It's also a really important factor is how well contained they are, how many exposure days were there before we knew that there was a positive case, how confident are we that people are being traced, that people are staying at home. All of those factors come into play as well. That's why those regional public health teams are really important. They're being stood up progressively. I think we'll see them up and running quite soon across all those regional cities that we nominated last week. And that means that there's if you like, a dedicated team in place who know that local community, who understand the geography, all those simple common sense things. I think we're very confident that they'll be able to provide that really intensive public health response, albeit for smaller numbers, but the risk is obviously very high that if we don't have a handle on those, if we don't have those people at home and a really comprehensive public health response, then numbers could grow. But I certainly got no advice from Brett or any of his team about changing settings beyond Metro Melbourne and Mitchell Shire, but we're watching those, every regional case very, very closely. And that's why, just as we're grateful to everybody in Metro Melbourne and Mitchell Shire for the work that they're doing following the rules, we're equally grateful to everybody in regional Victoria. The rules are different there, but there are still rules in relation to gatherings, in relation to hand hygiene. They're not required to wear a mask, but we are asking people to wear a mask when they're out and about for those just getting about their normal business, COVID normal business. If you are in any doubt as to whether you can maintain that 1.5 metres, then we're asking regional Victorians to wear a mask or a face covering as well. And I've had quite a few reports, certainly from the bigger regional cities, that a noticeable difference in the number of people that are doing that, and I'm very, very grateful to them.
Really, just on the numbers, are we seeing some signs, do you think, of flattening the curve in the second wave?
Laurel, I'm cautious about this. We had a very big day Friday. We then had a substantial drop off, even though we had done more tests. I think that what that shows you is that this is a wicked enemy. It is unstable, and until we bring some stability to this, we won't, I don't think, be able to talk about a trend. I'm certainly much happy to be able to report a lower number than a higher one. I think that we shouldn't lose sight of the fact that I know a day in this pandemic feels like a month. We're all very clear on that, but we still haven't yet reached the 2-week mark. It won't be until Wednesday, I think, that we get to the full 2 weeks of the stay-at-home orders across all of Metro Melbourne, albeit some of those hotspot postcodes in the north and the west, they have been under these stay-at-home rules for longer. I think that we shouldn't interpret this data as if we're in, say, week 5 of a 6-week lockdown. It is only early, and it does take some time. We've all become, I think, quite expert on the fact that this has got a life of at least a week, and then when you add a few more days for testing and just for an abundance of caution, a 2-week period is not unimportant. So let's wait and see how the week unfolds. Certainly we're always happier to report lower numbers than higher ones, particularly when you see testing continue at such a high rate. So 26,500 tests yesterday, that's a really significant outcome, and I can't thank those people enough for coming forward and getting tested. It makes a massive difference. You simply can't trace this, you can't track it, you can't have people at home and away from others if you don't know where those positive cases are. Logic tells you that. Plus, of course, the way this virus presents and has always presented, you can have very mild symptoms, maybe not even symptoms that you would necessarily register, but you can be out and about infecting people. So that's why testing is so important, and we aim to continue those numbers, and of course moving into some high risk settings like the testing, both symptomatic and the asymptomatic testing of aged care workers, for instance, as we announced yesterday. There's a really important part of that.
Just on aged care, with the union saying that some workers in some settings are having trouble getting the PPE that they require, and the union's even sending them emails on how to make their own masks. That's pretty alarming, isn't it, in that setting?
I've not seen those reports. The Commonwealth, of course, just to be clear, this is private sector aged care, public sector aged care, of which we have the biggest number of settings across the state. They are essentially part of the hospital system. So I don't think that criticism would relate to them. I'm happy to follow it up though. The federal government, we're very pleased to say, has committed, I think the number is around 5 million masks, so that private sector aged care staff can all wear masks, not just at work, but of course they'll be covered by other orders that we've put in place in terms of to and from work also, certainly from midnight Wednesday. The package of measures that we announced just recently in relation to aged care is a partnership with the Commonwealth, but I also want to give a shout out to the industry. They have understood that this is a really significant challenge when you've got casual workers, unbeknownst to them, bringing the virus with them to work and potentially infecting residents. That's the nature of our problem. It's not only something that will cause tragedy and has caused tragedy, but it also represents a significant portion of the numbers that we are standing here every day telling Victorians about. So for all those reasons, it's an appropriate package. On the issue of the availability of those masks, the federal government have made that commitment, and I'm confident they'll deliver those additional masks, but I'm happy to follow up on that.
As well as just those raw numbers of infections and so on, to what part is the pressure on the state from the number of healthcare workers, number of police, paramedics that are out of the system? Does that mean the more that they're out of the system, the lower the number of infections are to hit that critical threshold?
Sorry again, I'm not quite following.
So is a lesser number obviously good news, but when you
Yep.
have so many healthcare workers out of the system, the strain is equal anyway?
No, I wouldn't say that. I think that it's always challenging whenever you've got workers in those critical roles that are either furloughed because they're a potential close contact or people that have actually tested positive. There's a lot of interesting data in this about the percentage of people who in those roles that have contracted it at work versus contracting the virus through their daily lives away from work. There's always challenges when you've got any key staff that are at home sick in effect. But we've got contingency plans in place. We've got a very dedicated workforce across all those fields and more. And we're confident that even though, not to diminish the impact on those families and some of the real challenges that they face on a personal level, we are confident that we've got enough staff in place. I think overall though, you're always pleased to see numbers lower than they might otherwise be, but I don't want anyone to think that just because we've had a couple of days where we've seen a decrease, that somehow a corner has been turned and we can be less vigilant about following these rules. This is our new normal, at least for the next 4 and a bit weeks. And then beyond that, I think that we're going to have to embrace things like masks. So it's not just about masks today and face coverings. It's about embedding that sort of behaviour, because we know the medical evidence tells us that it can play a part. It's not the only thing. It doesn't mean, as I said yesterday, you can go back to shaking hands. It doesn't mean that 1.5 metres doesn't matter anymore. It doesn't mean you don't have to wash your hands. Of course, you have to do all those things as well. It's about, no one thing is perfect. No one thing will get you the absolute result. But the cumulative impact of all these different sacrifices, all these different steps that we're taking, will be to stabilise these numbers, drive them down, and get us beyond this second wave, just as it has done in so many other countries.
Are your ministers going to make themselves available if asked to Jennifer Coulter?
That's entirely a matter for former Justice Cope. Everybody should participate fully, but how the inquiries run is a function of both the terms of reference, which I believe are more than adequate, as well as the budget, that's more than adequate. As to how it's conducted beyond that, that's entirely a matter for Judge Coate, and I'm confident that she'll do that work well.
Will you go and give evidence if you're called?
Again, that's entirely a matter for Judge Coate. Everybody should be involved to the extent that they need to be. So, sorry?
If you're called?
Well, again, no, it's not for me to tell, and the thing is, part of that, I'm not going to tell a former judge how to do her work. She'll call whomever she thinks she needs to call, and anyone who's called should turn up.
The hearing you heard here this morning that government decision makers would be called, are you suggesting that nobody has officially been asked, either yourself or one of your ministers has been asked to appear yet? It hasn't happened yet?
Nope. I am absolutely suggesting that, because we've only had opening statements today. Who gets called, that's entirely a matter for the former judge. It's entirely a matter for an independent inquiry. The nature of their inquiry to give us the answers that we all need as to what went on here is very, very important. I would just remind you, I've been very clear about the fact that the ultimate accountability for everything that goes on in the government and everything that goes on in the state rests with me. That's the job I have. That's the job I do. This inquiry is very important. It needs to give us the answers. And it's not a matter of me sitting in judgment of myself or my colleagues or our agencies. It is about an independent process, looking without fear or favour and giving us the answers we need.
Are you concerned about reports some retailers have been price gouging on particularly disposable masks? Reports of 10
I have seen some of those reports. I'd encourage everybody to be fair and reasonable. I'd encourage everybody to do the right thing and acknowledge that this is no time to be profiting from the pain of others. There is no time to be doing that, regardless global pandemic or no global pandemic. But Lundy, to that end, we've got more than 2 million multi-use masks, like the ones that I was wearing when I came in, and that so many people in the room today are wearing. The first of those orders arrives this week. We will use some in our stockpile. We've already ordered replacements for those, so that'll be replenished because that's there for the very worst of outcomes. But again, I just remind people it's a mask or a face covering. It can be a handkerchief, a scarf, a bandana. There's all manner of quite innovative methods. They're all over the internet. People can look and find a way to comply, but giving people that bit of lead-in time as well is important. Can I just say this? There's been a lot of commentary, a whole lot of people who don't necessarily think that this virus is real or think it's somehow a fundamental attack on people's human rights. I just remind every Victorian that nurses and doctors wear masks when they're treating you, and I don't think it's too much to ask Victorians to wear a mask so that they don't finish up in hospital or contribute to somebody else finishing up in hospital. I think Victorians will embrace this, and I'm very grateful to them for doing it. It's a small thing. It's unusual, but it will make a difference. That's the medical advice to me. For the sake of avoiding some criticism from a small, I think, group of people, I was hardly going to ignore the advice given. The advice is, at this point in the pandemic, the circumstances we face, the reality we confront, masks across the board will make a difference. And therefore, if you're told something will make a difference, then you're obliged to do it.
Do you anticipate any difficulties on the New South Wales border this evening when the restrictions tighten tonight?
I had some conversations with Gladys yesterday. I can understand the decision that they've made. Jacqueline Symes is our Minister for Regional Development and someone who her electorate covers that entire border. She'll be the lead minister, having ongoing discussions with her counterparts in New South Wales. Gladys assured me that for freight, for the sort of essential movement that relates to the fact that many of these border towns are in fact one town, they might be in two parts. So whether it's Albury-Wodonga, Cobram, Barooga, the list goes on, Mildura, Wentworth, we often provide services into southern New South Wales. People often have to travel for work. I know there'll be some really practical issues that people have to work through, but I've got an open line of communication with my Premier colleague in New South Wales, and I'll continue to speak with Gladys, and Jack Symes will continue to work with her counterparts to try and make a difficult set of circumstances just a little bit easier. They won't be easy though, we know that, but I can understand why Premier Berejiklian has made the decisions that she's made. Let's try and work together to make them as practical as we can, to make them as common sense as we can.
Premier, what do you think about the 20-odd people in a city apartment last night that police came across having a party?
Well, this is no time for parties. This is very serious, and we send our love, our thoughts, our prayers and best wishes to the family of the woman in her 80s who passed away since we were last on this podium. I can't say that there won't be further deaths. I think that if people just think about that for a moment, there are many families across our state who are dealing with the fact that a loved one is in hospital, that are dealing with the fact that a loved one is needing a machine to help them breathe. There are many families across Melbourne that are planning funerals at the moment. Now's not the time to be having parties, breaking the rules, and not only putting yourself at risk, but potentially risking the health and well-being of others. And I again stress, whilst these most recent deaths have been in older people, that's reason enough for these rules. don't misunderstand the point I'm making, but we have an enormous body of evidence across the world that show people who are otherwise healthy, people from all age groups, that have died because of this global pandemic. The other point that Professor Sutton has made, and increasingly the medical literature supports across the world, many people who get COVID-19, they get well, but well in the context of a chronic condition that lingers for some time, not the notion of a common cold where you would be well only a few days later, but something that lingers with lasting impacts for a period of time. Now's not the time for people to be having parties. Now's not the time for people to be breaking the rules. This is the reality we face. We didn't want to be here, but we are, and we've all got to step up and play our part, large and small. Have a party at another time. Not only is that the right thing to do, it's also the smart thing to do, because as that example shows you, Victoria Police are out there and they will issue fines. They don't take any joy out of that, neither do I. I'd prefer that everyone was doing the right thing and police didn't need to be enforcing these rules the way that they are, but that's not the reality we face. So thank you to everyone who is doing the right thing, and a message to all of those who aren't: don't make selfish choices, make better choices. That's the right thing to do. It's also by far and away the smarter thing to do, because Victoria Police are out there and they are taking this as seriously as they need to.
What do you think of federal parliament being cancelled?
Well, that was a matter, I think, on advice from the Chief Medical Officer, Paul Kelly, and his team, and just as throughout the entire pandemic, when you're given advice by the medical experts, particularly the public health experts, then the appropriate thing to do is to follow that.
Given the seriousness, though, of the situation, do you think that the work of federal parliament should continue in some way?
Well, not if it's against the advice of the Chief Medical Officer at a national level. I think you can't pick and choose. You've got to follow the advice, and that's exactly what the Commonwealth Parliament, through its presiding officers, and indeed the Commonwealth Government, have got that advice, and they've made, I think, obviously everyone would prefer the Parliament to be sitting. It's a difficult set of circumstances, but when the advice is clear, then you've got no choice but to follow it.
Is the Victorian State Parliament still going to sit first week of August?
There's no change to those plans, but again, I would just make the point that, again, that's part of, I've answered this a few times now, if advice changed, then again, that's a matter for the Speaker and the President, but the last thing anyone wants to do is to be contributing to the spread of the virus. But at this stage, I'm planning to be there. I think that there's been no announcements made, there's been no advice, but that is quite some time off. As I said before, a day in this pandemic is very much like a month.
Just on schools, is there a chance now, given that numbers have continued to go up since the announcement was made, that remote learning period may now be extended? Is that looking more likely?
Well, I'd say that we've got orders that run for 6 weeks. So we're just about to hit the 2-week mark out of that 6-week stay-at-home order. That's aligned with the flexible and remote learning and the special arrangements for Year 12, kids with special needs, kids of essential workers or workers who can't be at home, and of course specialist schools. We will need to see where the numbers are as we approach the end of that 6-week period. 6 weeks should be enough if we are all following the rules, if we're all playing our part. So coming forward and getting tested if we're sick, if we're told to isolate, then staying at home, only going out for the 4 reasons that are lawful, and then only doing that when you absolutely need to, not seeing those 4 reasons as a fundamental invitation every day to go and do each of those 4 things, but instead to work from home if you can work from home, to go to the shops when you need to get things and only for the things you need. All of those common sense rules to exercise, but not necessarily be cycling from one side of Melbourne to the other and buying a coffee at the other end and then coming all the way back. Daily exercise is not a day trip. And again, I don't enjoy having to point these things out to people, but you know, ultimately, if you're seeing this sort of stuff happen, you've got no alternative. I'm not going to, for the sake of politeness, not mention the fact that some people are going well away from their local community, and it is not a daily exercise, it's not fresh air, it is much more than that, and it is not only against the spirit of these rules, it's actually against these rules, and people should just use much better judgment. We'll all get to the end of this much faster, whether it be from a remote and flexible learning point of view, a stay-at-home order point of view, getting restaurants, bars, cafes, pubs back open, seeing people living a much closer to normal life, albeit it will have to be a COVID normal for the foreseeable future.
There's been an outbreak at an abattoir in Colac. They're
Yes.
saying they're having to sort it out themselves because the uptake from the DHHS has been a bit slow. It's something we keep hearing about. Is that good enough?
Well, I'd need to confirm the details of that. There'll be a media release from the Chief Health Officer later on today, the 1:30 update with all the different outbreaks in it. We know that abattoirs and meat processing, as well as a number of other settings, are very challenging. That's why there are protocols in place. That's why I think every abattoir owner across the state is using their best endeavours, and I'm very grateful to them to do everything they can to try and stop the spread of the virus. But when people are working in colder temperatures, when people are working quite close to each other by nature of the work, it can be very, very challenging. I'm happy to follow up on that individual case to the extent that it isn't dealt with later on today, but I think it will be a feature of that outbreak update. On contact tracing more broadly, I just want to again make the point, this is a massive task. It is a massive task. And not necessarily everybody answers the phone when you call them. Not necessarily everybody is where they might be expected to be when you're trying to track and trace them. If it was simple and it was just pressing a button, then of course that would be much easier. But it isn't. It's a big, diverse group of people. And I don't think anyone necessarily enjoys having just been told they've got the virus and then going through all the steps about what will be involved for the next 2 weeks. It's an anxious time, it's a challenging time. What I can say is the task has never been bigger, but the team has never been bigger. And they are fantastic Victorians, as well as support from other states and ADF members as well now, members of Ambulance Victoria, members from the private sector who've got some of those specialist skills. It's a big, big task, never been bigger in fact, but the team is bigger than it's ever been also, and they're all doing their very, very best. My advice, my message to those who test positive, if you get confirmation that you've tested positive, then you shouldn't need someone to call you to know that you have to stay at home, and that your close contacts, they need to stay at home as well. People in your family. You will be contacted as soon as is possible. That can take many forms. It might be a text message in the first instance, or an email, and then that long form interview, which can take an hour per person to go through, retrace their steps, go back through where they've been over the last few days, and then on contact all of those other people. So it's a big, big task, and they're doing their very best. That's all you can ask of people. But the team's getting bigger, and it needs to, because the task has never been bigger.
On the issue of contact tracing,
yes.
Given there have been more than 4,000 cases, the Victoria's COVID Safe app was launched.
Yes.
And it's been accessed 300 times for 0 extra contacts. What is it exactly about the app that isn't working perhaps as well as you would have liked it?
Well, the app is always, the utility of the app will always be determined by the number of people who actually download it. So the more people who download it, the more use it will be. That's not a new point. That's a point that's been made, I think, by many and often. The other point that I'd make, that Bluetooth handshake is about settings where you don't know the people that you are quite close to. So, for instance, and I'm not sure to what extent the app was useful at the Crossroads Hotel up in Sydney, but that sort of setting where there are hundreds and hundreds of people that are gathered together, many of whom would not know each other. That's just the nature of a pub or a gaming room or wherever it might be. That's where the app can have its most powerful impact. I'm not sure how many contacts were able to be traced that wouldn't have otherwise been known, but that's the sort of example where the app works really well. The app, I think, is probably of greater use in a more open place, if you like, as you're opening up, as you're moving around more, and you're not necessarily quite as clear on who your close contacts are. Right now, where people are at home, except if they can't work from home, or for one of the other 4 reasons, then I think most people are able to tell us, albeit it's a challenging thing. You've got to go through and retrace your steps, but I think most people are able to tell us who they've been with, who they've been near, who they've been proximate to in the relevant period. I can't. All I'd say to people is download the app, because the more people who have it, the more use it will be.
Given what we've been told about masks, like, does the handshake time perhaps need to be reduced? Would that make it more useful if we say, a 5-minute handshake rather than 15 minutes?
I'm not sure about that. That's something that I could ask Brett about. We could potentially follow up with the Commonwealth. The program is run by them. The settings are run by them. I think that it's something you should download. I have. Every member of my household has. But again, the key point there is the only people that I'm spending any time with are you good folk. We're all 1.5 metres apart, and members of my own household. So the fact that I've downloaded it probably wouldn't mean much in the event that I had to be contact traced. But there will be other settings, and certainly when we get to that next phase, once we're beyond the second wave, where the app will be of greater use. On the issue of how long it takes to ping, if you like, I'm more than happy to take that up. No.
Is any consideration being made to any changes around the rules with abattoir or leather operated, or even if they can open, or how they operate?
I think that there's a pretty clear understanding of the fact that abattoirs, meat processing centres, large cool store type arrangements are particularly high risk. There's a well understood and quite a detailed checklist, if you like. There are many rules that are in place. They're not operating as normal. They've certainly made many changes, and I'm grateful to everybody in that sector, not just employers, but obviously workers also. I've got no advice or any sense that there needs to be a change made there. But again, if Brett, or at a national level or even at a global level, because we've seen some very significant outbreaks in other parts of the world, thousands of cases, if there was deemed a better protocol or a different way of doing things, and I'm sure we'd be open to that. But we'd work with industry to do that. We wouldn't want to change the rules overnight or anything like that when it came to such a significant industry. But by and large, the reports I get, in fact, more than that, the vast majority of these settings, the reports I get is that employers and workers are taking things very seriously, and I'm grateful to them for it.
Just a quick one from you. Do you know if the lady who died overnight, was she an aged care resident at all?
She was. Further details about that, again, subject to privacy and her family's consent. I think that'll be picked up in the Chief Health Officer's update later on, which will be at 1:30, as it always is. Any other issues?
With the inquiry, it's gone a lot slower than the comparable inquiry in New South Wales, which is a Ruby Princess and all the issues that arose from that. Is that a satisfactory outcome?
Well, I think that I wouldn't have seen it that way, Noel, but people are free to make that observation if they choose to. But I think that former Justice Coate, counsel assisting those who are supporting her in that important work, they've not wasted any time at all. They've been reviewing documents by the box load for a couple of weeks now, pretty much from the day after we announced the terms of reference and that former Justice Coate would be doing that important work. The conduct, the timing, how they do that work is entirely a matter for them. But I certainly, I don't see it as anything other than people doing a complex job and doing it in good time. So I don't think they're wasting any time at all. In fact, I think if many would perhaps not have thought that opening statements would be quite this early, they're taking this very seriously, as they should. What went on is completely unacceptable. We need to get the answers. We need to know exactly what happened, and this is the process to do that. Any other issues? You sure? No worries. We'll see you tomorrow.